So moving on to the general situation and number of cases that we have for today. We have, to date now, active cases in Thailand, 2,782. So if someone asks you how many cases in Thailand are current cases under treatment, how many people in Thailand do have COVID at the moment now, 2,782. The daily number of new confirmed cases that we have is 198, as you can see on screen. The total since last year is over 13,000. The total recoveries, discharged persons, since last year is over 10,000. So we're getting there. We're getting to the mark. The numbers are closing in. Unfortunately, one new fatality we have to report for today, making the cumulative number of fatalities in Thailand now standing at 72. This new fatality is a Thai national from Phichit province. Just some observations. Just now, we had the briefing by Dr. Pan Prapha in place of Dr. Tawisin today. Only for today. He'll be back soon, actually. Just some observations from that briefing, that active case findings continue in Samut Sakhon. They have been proven successful in helping to find more infections that would lead to better control of the spread. In terms of today's infections in particular, the figures today in particular, the highest number province is Samut Sakhon with 56, and in Bangkok with 5 new cases, and the rest are from other cases. Today we have 198 cases. Out of this number, 111 are from active case finding, 69 from local transmission, and 18 from state quarantine. From 198, in that number, as I said just now, Samut Sakhon 56, Bangkok 5, and the rest from other localities. So therefore, we have to still keep, of course, a high guard up. The infections in terms of provinces now remain only in 63 provinces. So no additional provinces had been affected as compared to yesterday. 63 out of 77 in Thailand, total in Thailand. So some information for the English language audience on vaccine. I believe you're interested in that. Vaccine updates in Thailand. For those who are worried about the progress of this development in Thailand, just to inform you that our own medical scientists are now preparing the first trial of locally produced vaccines. This is, of course, separate from those that will be procured. This is called COVID-19, developed by the Faculty of Medicine of Chulalongkorn University. Expected to be injected into some 72 testing volunteers aged between 18 to 75. And this COVID-19 employs the RNA or messenger RNA or mRNA, which enables the body to produce protein that triggers an immune response to the virus. This same method is used by leading pharmaceutical companies such as Moderna, Pfizer, and BioNTech, which indicated that their vaccines are more than 90% effective in preventing the disease. So Chulalongkorn University Vaccine Research Center revealed that the results of phase 1 should be known within June, which is 2 months after the planned inoculation for this group, after which the research team will learn what appropriate doses will be used to create the most effective vaccines. The team will also move on to phase 2, where trials will be administered to volunteers, then phase 2B with another group of volunteers. If all goes as planned, this COVID-19 domestically, locally researched and produced vaccine could be manufactured by the end of this year. So this is in addition to the procurement plan that we have. Another information is about our cooperation with the International Organization for Migration, IOM, once again. There are many projects that we have been in cooperation with this particular organization. It has rolled out a new application called MOVE, M-O-V-E, which is an interactive and actually fun way to help people, including migrant workers, learn important information about COVID and how to best prevent themselves. It's easy to download and user-friendly. The application also provides information in Myanmar language, in Lao, and Khmer, English, and Thai as well. And you can watch video clips on how to keep safe during COVID, as well as watch the short clip on measures implemented to stem the spread, along with surveys carried out to report on the latest COVID situation in your area. This application can be downloaded by scanning the QR code, which will be coming up on screen. And you can also visit the IOM Thailand Twitter account for more information. So I believe we have something coming up. Yes, coming up on screen. This is the QR code. And then we can continue with the other infographics or pictures or clips that we have. Okay. Okay, so from this QR code. So just additional points before ending. As you can see from the incident yesterday, COVID-19 is closer to us than we think. And as I have said before, it does not discriminate, no matter who you are. However, it does not mean that we have to be scared or let it prevent us from living and enjoying our lives. Let's stress once again that the best medicine for the virus is our own awareness in protecting ourselves and in the extension to protect others around us. Please remain vigilant and cautious and careful. And of course, always wear face masks, wash your hands constantly, and respect social distancing wherever possible. In this connection, the Health Ministry has also advised that if you have been in close contact with infected persons while not wearing any face mask or not wearing face shield or face masks for at least 15 minutes, you should get advice in terms of whether to get tested for COVID or not. The ministry, the authorities will of course be asking you questions in the hospitals to evaluate the need of this testing. The Health Ministry also emphasized that even if the first result came back negative after you take a first swab test, it is necessary for you to do quarantine for the next 14 days of observation, as the incubation period of COVID usually lasts from 2 days to 2 weeks. So thank you very much for your kind attention today, and have a great weekend, the rest of the day, and we'll see you again tomorrow. Just ending with this quote, as you see on screen. I'll repeat that once again. It was up yesterday. It might be stormy now, but rain doesn't last forever. Please stay healthy. Thank you for your attention. สวัสดีครับ